Welcome to the Data Extract, final milestone in the EMR adoption program, hosted by the Primary Care Community Physician Information Systems Office at Manitoba eHealth. The goals of this presentation are as follows: to provide a review of the final milestone requirements of the EMR adoption program related to the data extract, to provide more specific detail about the data extract phase of the program, including the purpose of the data extract, the information contained in the extract, the requirements for a successful submission, and both the short and long-term benefits of submitting an extract along with future periodic extracts, to provide an overview of how the data is being transported, and finally to summarize some key points related to preparing and submitting data extracts for the program. I will begin with a quick overview of the purpose and goals of the EMR adoption program itself. Manitoba Health, Manitoba eHealth, and Canada Health Infoway have partnered to encourage EMR adoption through partial reimbursement of EMR expenses. The goals of this partnership are to improve efficiency and quality of care within clinics, to improve interactions with other providers and institutions through integrated IT systems, and to improve the healthcare system through better planning and analysis based on improved information. Periodic data extracts are an integral part of meeting these goals as they directly support planning, delivery, and evaluation of primary care services and programs through the analysis of the data and the reports that clinics are provided by Manitoba Health. The data extract process also serves as a key point for clinics with respect to improving their data quality within their EMR to assist in improving efficiency and quality of care within the clinic. With this in mind, the EMR adoption program was developed and structured around milestone requirements involving specific clinic obligations. The following obligations must be completed in order to be eligible for the final milestone in the program, which includes the first successful periodic data extract followed by the release of final reimbursement funding. At this time, I will not go into each requirement in detail, but will focus on the items that directly have reference or impact on the data extract. By signing the funding agreement, clinics and their enrolled clinicians are agreeing to submit data extracts from the clinic's approved EMR solution to Manitoba Health on a periodic basis. The Information Sharing Agreement, or ISA, contains more specific description of the data elements contained in the extract. It explains the objectives of providing data submissions and contains the terms of the agreement, including use, disclosure, and protection of the information. The ISA is signed at both the clinic level and by each enrolled clinician, stating they agree to the terms and conditions outlined in the agreement. All obligations and requirements in the program must be completed by the 24-month enrollment deadline. Both the final submission for eligible expenses and the clinic's first periodic data extract successfully submitted to Manitoba Health must be completed by this deadline. Completion of all the requirements releases the final reimbursement payment from the EMR adoption program. If you have any questions about your clinic status in the program, including your 24-month enrollment deadline, please contact your clinic service representative or CSR. One of the primary goals of Manitoba Health receiving periodic data extract submissions is to provide clinics with valuable information. Once successfully submitted, some of the ways that Manitoba Health may be using the data include to generate analytic reports that will be provided to clinics to support clinical decision-making. As an example, clinics will receive data quality reports after each submission to assist in managing, improving, and optimizing their EMR data. To assess the adoption of EMRs into clinical practice, the extract data will help to measure the success of EMR adoption province-wide, assessing the effectiveness towards improving the quality of healthcare in Manitoba. To perform analysis and reporting on population health. After 6 successful monthly submissions, clinics will be sent a comparative analytic report focused on chronic disease management, comparing data province-wide. To support improved primary care delivery by monitoring quality of care indicators. Examples of quality of care indicators could be elements such as dates for preventative screening in relation to chronic disease management. Potential future initiatives include using the data for planning, delivery, and evaluation of provincial and regional primary care initiatives. The following series of slides will describe the information contained in the extract. There are a series of specific data elements that are to be submitted in 7 distinct files as follows: demographic data, prevention data, and then data from 5 chronic diseases structured after the CDM billing tariff: diabetes, asthma, congestive heart failure, hypertension, and coronary artery disease. Please note that a full table of the data elements can be found within the Information Sharing Agreement, including the data element description, purpose for or patient population that is relevant to that element, along with the type and format of the element within the extract. Once submitted, the data will be validated to determine whether it meets the minimum acceptance criteria to be deemed successful. After submitting the extract, Manitoba Health will be validating the data, specifically focusing on the demographic file. A minimum of 85% of the demographic data must be complete to meet the minimum acceptance criteria for a successful data extract submission. These elements are shown here in red and include a clinic identifier, which uniquely identifies each clinic with respect to their extract. This will be provided to you by Manitoba eHealth during the technical setup to transport your data. Manitoba Health Physician Billing Number, used to confirm enrolled clinicians have submitted data in order to release reimbursement funding. A patient identifier, which is a unique number assigned to the patient automatically by the EMR. Manitoba FIN number, which is used to track quality indicators for patients. Date of birth used to determine age necessary for several indicators. Gender used to determine eligibility for certain indicators. And date of last visit. This is a key piece of information to complete a successful submission, as the extract was built to capture data from all patients who have been seen in the last 5 years. Once you have submitted your monthly EMR data extract, you will receive a notification that your extract has been received and will begin processing as soon as possible. Once the processing begins, clinics will receive one of 3 email notifications describing the status of the submission. There are 2 points of validation in the submission process. In the first step, Manitoba eHealth will be validating the 4-digit clinic ID previously noted, confirming that all 7 files are present, named correctly, and in the correct .csv format. If any of these items are missing or incorrect, clinics will receive an incomplete extract notification. Please note the body of the email provides instructions on how to proceed with correcting your submission. The second point of validation occurs after the data is analyzed by Manitoba Health. If your extract does not meet the minimum acceptance criteria of 85% of the demographic file, clinics will receive the unsuccessful notification. In the case of an unsuccessful submission, clinics will have support and assistance from both their CSR at Manitoba eHealth and Manitoba Health until they have successfully submitted. However, clinics will need to play an active role in the process. Once you have submitted a complete extract and you pass the minimum acceptance criteria, you will receive a successful notification. In the body of this email, there will be information about the reports you will receive after Manitoba Health has analyzed the data. At this time, I will give a brief overview on the data transport service, which explains how the data gets to Manitoba Health for review. The first step is to work with Manitoba eHealth to install software on-site on the clinic's hardware to act as a secure pipeline for the data. In most cases, instructions can be given over the phone. Once registered as a secure courier, the clinic is authorized to submit their extract to Manitoba eHealth. Someone at the clinic generates the data extract. The courier checks the data extract folder periodically and picks up the files if present. The data is transported securely via the courier to Manitoba eHealth, where it is validated. If the data is not validated, clinics will receive the incomplete notification email, and the data will not be transported through to Manitoba Health. When the data passes validation, it goes through to Manitoba Health and is then stored in the repository for analysis. If the clinic has not met the minimum acceptance criteria, they will receive the unsuccessful extract notification, and the data will not be stored or analyzed. Once successfully submitted, Manitoba Health will share some of the results from the analysis back to clinics in the form of reports. These reports are among the key benefits to periodically submitting extracts, which I will now describe in more detail. There are 3 key benefits to submitting periodic data extracts to Manitoba Health, and they all revolve around Manitoba Health sharing information obtained as a result of the data extract analysis back to clinics. The first benefit are data quality reports. These will be sent to clinics after each successful submission and can assist in determining if your clinic EMR data is complete, accurate, and reliable. These reports can help to highlight areas to run reports and queries to assist clinics in turning their EMR data into information their clinic can use. A quality in equals quality out mindset. Your CSR can provide you with a common data quality issues handout to get you started. Shown here is a sample of a data quality report. There are 2 primary components to the report. Section 1 focuses on reasonability. Do these patient counts make sense with respect to your clinic population? Keep in mind the extract is programmed to generate data from all patients seen within the last 5 years. Section 2 is focused on data anomalies, such as missing FIN and date of birth, outlining both the number of occurrences of a certain error, along with the percentage of total patients seen with that same error. We recommend clinics focus their data cleanup efforts in the FIN, date of birth, and gender areas to begin. Leveraging the queries and reports functionality in your EMR can help you determine which records contain the errors and whether corrections are required. For example, the invalid FIN analysis indicates a patient record where a value is populated in the FIN field, but is not a number registered with Manitoba Health as a valid FIN. This may include FIN numbers that are incorrect, as well as RCMP, military, or out-of-province values. Reviewing these records will allow clinics to make strong decisions about what data requires correction to maximize their return on investment and tie into the final benefit of the data extracts, which I will discuss shortly. Clinics will also have the choice to request an encrypted CD from Manitoba Health that includes the specific patient records containing detailed information on the errors noted in the data quality report. This is to further assist clinics in their data cleanup efforts. The second key benefit are comparative analytic reports. Clinics will receive these after their first 6 successful monthly submissions and then twice per year to support practice reflection. They are chronic disease focused and structured around the 5 chronic diseases included in the current CDM billing tariff. They compare individual clinics with all the data in the repository, in other words, all the clinics in the program. It is easy to see the value of these reports will increase as more data is submitted by more clinics over time. The next 3 slides show samples of the comparative analytic reports. Each report will be received twice per year and will focus on one of the 5 major chronic diseases that are captured in your CDM billing tariff and in the data extract. On the first slide, I will draw your attention to Figure 2 in the bottom right-hand corner. This pie chart displays the proportion of patients with either no chronic condition, 1 chronic condition, or 2 chronic conditions compared between your clinic and all the clinics who have submitted extracts through the EMR adoption program. The next slide shows an example of comparative analysis specific to hypertension. Figure 4 in the top right shows the age and gender breakdown for patients with hypertension for your clinic, alongside the data analyzed from the rest of the extract repository. With respect to hypertension management, this comparative analytic report provides the information that screening and prevention is a useful part of monitoring a patient's progress towards a healthy lifestyle. Figure 7 shows the proportion of patients screened for preventative purposes broken down by fasting blood sugar, renal dysfunction testing, obesity screening, full fasting lipid screening, and blood pressure management. Again, you can clearly see the comparison in numbers of patients between the individual clinic and the rest of the repository. This is a great example of how continuing to submit data extracts supports improved primary care delivery by monitoring quality of care indicators. The third benefit we believe to be the key benefit for most clinics. After 12 successful submissions, Manitoba Health will assess data quality, and if acceptable, clinics will have the opportunity to replace their current CDM patient care treatment forms with the EMR data extract. Clinics should leverage their data quality reports to improve their EMR data for each subsequent extract submission. Keep in mind that the elements to meet the minimum acceptance criteria will be changing over time to align with the elements contained in the CDM patient care treatment forms. In order to be eligible for the CDM replacement, clinics will have to play an active role in bringing their data to a higher standard, and we encourage clinics to start early. Both your CSR and your vendor can be a source of valuable information on this topic. In conclusion, I have a few key points for clinics to remember. Your first successful data extract must be submitted by your 24-month deadline in the EMR adoption program and is dependent on your clinic completing all its requirements. Remember that periodic future extracts are an obligation of the program. You will be reminded by email once a month to submit subsequent extracts. The information sharing agreement is in effect until March 31st, 2015, agreeing to sharing clinic data with Manitoba Health. It is the clinic's responsibility to ensure that only data from clinicians who have signed the ISA are included in their extract. If you have clinicians at your site that have not signed the ISA, please communicate with your CSR about options. Manitoba Health has agreed to delay the requirement for specialist physicians to submit data extracts. As pediatricians often provide primary care, they will be required to submit at this time. It is important to know that specialists may have to submit data in the future when the extract is amended to include elements applicable to specialists. Your CSR is the main point of contact about your status in the program and the benefits of submitting data. They can provide you with a data extract orientation, including a clinic handbook outlining all the information discussed here. Your vendor will be the main point of contact for how to prepare for the extract and also for instructions on how to generate the extract in your EMR. We strongly encourage clinics to consider early preparations for their data extract so they can maximize their chances of successful submissions. Ongoing submissions will allow your clinic to best leverage the reports in order to optimize your EMR data and bring your clinic closer to the opportunity of replacing the current CDM patient care treatment forms. Remember, one of the long-term goals of the EMR adoption program is to improve the healthcare system through better planning and analysis based on improved information. Your clinic will be a key contributor to reaching this goal through ongoing submissions of data from your EMR. Continuing to submit EMR data extracts benefits everyone. The more we know, the more opportunities we can offer you to use your EMR effectively. That brings us to the close of this presentation. If you have any further questions, please contact your CSR in the EMR Adoption Program or contact the PCIS office at 204-926-3482. Thank you for watching.